The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
I do think that one thing that we don't talk about enough is, okay, what kind of skin do you have before we start? Fitzpatrick skin classification, dermis, all that good stuff. What do you tell your patients?
So this is a very important concept. So if you Google Fitzpatrick, it'll give you a little questionnaire, and that will help determine what skin tone you are. And it's basically, we're talking about the depth of your skin quality, how active your melanocytes are. So the lightest Fitzpatrick 1, it's going to be those Irish looking people, redheads, very freckly, skin that's so fair that they're almost translucent, really, really light eyes. And then all the way down to like deeper ebony tones, never burns, only tans, and then everything in between. So based on your eye color, your skin color, your propensity to burn or tan, we can classify you. And this is important because certain types of procedures like resurfacing may be appropriate for some or all or none of these categories, depending on what we're talking about. What's the most common Fitzpatrick skin classification patient that you see?
Mainly 2 or 3. And I'm with you. At least in the US, I don't think we see that many people with classification 1, which is the most pale, because essentially if you have an ancestor from Southern Europe or who's Hispanic or you're Asian, you're going to have by default probably number 2 as opposed to number 1. Number 1 implies that all of your ancestors are from Norway or something.
So I always say I was like the ideal candidate for a resurfacing of any kind is going to be like a Scandinavian blonde. Like people have got almost no pigment, and they require the least preparation. But the reality is you can significantly increase the number of patients who are candidates for these procedures if you prep their skin. And that's a really, really important concept. It can be the difference between complication, no complication, or just like an okay result and a really, really great result.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.